Okay, so welcome everybody. My name is Zoe. I am the branch manager here at the Washougal branch for Fort Vancouver Regional Libraries. Thanks so much for joining us tonight for our maintaining cognitive function and brain health. I'm going to ask that everyone, if you are not already muted, if you will go ahead and mute yourselves for the presentation. We're going to save questions till afterwards. You're welcome to type something in the chat and I will kind of monitor that. But we do want to save all the questions until the end if there's time. Again, we are recording this and it will be put up on our website. It'll go out for closed captioning. And so it'll give it a week or so and then it will show up on the website. So if there's something you missed or you want to rewatch it or you want to take a look at some of the slides again, we will have those available for you. Okay, and I think that's all I have to say. So I am going to hand it over to Dr. Cecily Cox. So welcome and thank you.
Hi, everybody. Thanks, Zoe. I'm Cecilia Cox. I'm a naturopathic physician, and I'm really excited to talk to you today about optimal brain health and function. Let's see here. I need to be able to forward my slides, Zoe. Yeah, there it is. Okay. So currently I work at Ripple Wellness. Ripple Wellness is a multi-modality health clinic that is located in Washougal, Washington. They offer naturopathic medicine, acupuncture, massage, nutritional counseling, yoga, breathwork, mental health counseling. I will be at Ripple until June 1st this year, and then I will be taking some time off and starting a clinic again outside of Ripple in October. And if you are interested in being on the Ripple Wellness mailing list, or if you want notification about my upcoming clinic, I am going to ask you to please put your email in the chat box and we will get in touch with you. Okay. So the highlights of today's talk are going to be the determinants of brain health and the degeneration of your brain. 6 pillars of brain health. We're going to talk about the things that you can do right now to prevent cognitive decline and how to stay sharp. We're going to talk about some testing options and markers that are important to keep track of to optimize your brain health. And we're going to talk about supplements and herbs and what works and why. The information that I provide for you today is for educational purposes only. Please don't substitute this for professional medical advice. Talk to your doctor if you want to try any of the supplements I mentioned, or if you want to partake in exercise or any of the other activities that I will be talking about. So in my clinic, I often have people who come in who have a family history of dementia, and they're concerned about their own future risks, and they want to know what they can do. I also have more than often people coming in with complaints of not feeling as sharp as they used to, and maybe having some brain fog, losing words, and they want to know if this is maybe the beginning of dementia early, or if this is something else. So they want to know what they can do. And so in order to really talk about brain health and function, we really need to know what's happening in the brain and what happens when your brain is aging. One of the things that happens is that the volume of the brain declines, and this starts early on, 30s, 40s, midlife. And the parts of the brain that decline are really, or shrink, are really your prefrontal cortex and your hippocampus, and both those are regions that are involved in complex mental tasks and in learning. There are also more global changes to the nerves generally in your brain, to the myelin sheaths and the axons, and to blood flow and to the communication between your neurons. The good news is that neurogenesis, or the formation of new nerves in your brain, happens throughout life. That was not always thought to be the case. It wasn't that long ago that people would thought that you had a certain amount of brain cells and that was it. But it turns out you can make new neurons, and then you can promote stem cells to differentiate. The other part is that neuroplasticity continues throughout your life. And neuroplasticity really is the ability of your brain to change in both structure and function in response to experiences that you have, stimuli, or even injuries. So the brain health is one thing. Cognition is what we normally think about when we think about good brain health. And cognition really includes all forms of knowing and awareness and perceiving and conceiving, remembering, judging, basically being aware that you are alive and making your own decisions. Cognitive health can be maintained, and the loss of brain function and health, and even development of Alzheimer's disease can be prevented or significantly delayed. And worldwide, there is a pretty good consensus on the fact that 40% or more cases of dementia can be prevented. To me, that's astounding. So I really want to know, and hopefully everybody would want to know, how we can do that. How can we slow things down? How can we prevent dementias? In the United States right now, or as of 2022, there were 6.5 million cases of Alzheimer's disease. Alzheimer's disease makes up about 60 to 70% of dementias. There are other forms of dementias, of course. There's vascular dementias. There's Lewy body dementia, frontotemporal dementia, and what is just mild cognitive impairments, or something that we kind of associate with aging. So what drives the loss and the damage of neurons and the consequent loss of function? Well, there's a decrease in circulation. There's oxidative stress and inflammation. The blood-brain barrier can become compromised. There's a buildup of amyloid beta and tau tangles. And I know amyloid beta and tau tangles are what people normally associate with dementias or Alzheimer's disease in particular. But lots of other factors play in. There's a decrease in growth factors as well. Your mitochondria get damaged or die off, and I'll explain a little bit about that. And then there's a buildup of senescent cells, or cells that are kind of useless and damaging. And of course, mental health plays a large role in cognition and brain health, but that is a very large subject, and I think a future lecture would be what we need for that subject. So let's see if I could just figure out how to forward here without hesitation. That would be great. So, given that, then the determinants of good brain health, these are not all of them, but it's a good amount, is really to have good cerebral blood flow, to have low levels of oxidative stress and inflammation. We need to have a blood-brain barrier that functions well. We need to clear out amyloid beta buildup and prevent the formation of tau tangles if we can. We need to, have sufficient growth factors. And there are things that we can do to promote the growth factors. So more on that later. We need to have good mitochondrial integrity, and we need to have clearance of these senescent cells or useless cells and active autophagy. So failure to support any of these determinants really drives the loss of neurons. And that could be one or many of them. The more places that we can add in support and prevention, the better off we are. We really are looking at raising the bottom line here, raising our baseline, so that if things happen, and you will age, so that will happen, but there could be other insults as well. So the healthier we are to start off, the better off we are. So that's prevention, prevention, prevention. And it's a mantra that I like to talk about and mention all the time. So let's go through these determinants one by one. Cerebral blood flow. This is a picture of the blood flow in your brain. Look at all the arteries and the capillaries in there. It is amazing. So the blood flow really decreases naturally with age because of stiffening of arteries, and we do get some plaque buildup. But if you have, for example, high cholesterol levels, high levels of inflammation, and these for glycoproteins that can deposit in your arteries, which are the result of high blood sugar levels. Those all add to dysfunction of these blood vessels. And then these blood vessels basically don't supply nutrition and oxygen to those parts of the brain, and the neurons around that blood vessel don't do so well. Say, for instance, you have a stroke, you have no blood flow to an area of the brain. That part of the brain basically dies. So it's good to have a lot of reserves and a good baseline to start with. On an MRI, you can actually see small vessel disease. They show up as white matter lesions. And these white matter lesions really, white matter in your brain plays a crucial role in just the connections between the neurons. They really make up what are called axons. And these axons are wrapped up in myelin, which is like a insulator for those axons. And without the myelin and without the axons functioning well, the transmission of messages between your neurons is greatly slowed down. This is a picture of a neuron. You have the cell body on top, that would be gray matter. Then you have the axon, so the message has to go from the body through the axon to the other neurons. And that axon is wrapped up in white matter, and it's this white matter lesion that we can see on an MRI. This white sheet around the axon is really made by another cell in your brain called an oligodendrocyte. And so we need to take care of them as well. And when you have low blood flow, the myelin sheath gets damaged. It needs a lot of nutrition. Okay, so then the second determinant is really oxidative stress. Oxidative stress, or the formation of free radicals, is perfectly normal. It happens in all metabolically active tissues, and your brain is a very highly metabolically active organ. When there's an imbalance between oxidative stress and our endogenous antioxidant systems, then we have damage that can occur to your DNA, to the proteins, and to the lipids in your brain. This is a picture of basically the things that can cause reactive oxygen species. So we already talked about metabolism, but then you have the stressors from the outside that also come in: bad food, pollution, heavy metals, viruses, bacteria. All those add to the reactive oxygen species, or oxidative stress, and then they go to form they damage your lipids and proteins and DNA, and it causes cell death. What we can do is we can augment the antioxidant systems that we already have by eating well, by taking in antioxidant foods, and we can supplement with antioxidants as well. And of course, exercise and several other things can be helpful. This is a picture of some of the molecules that causes oxidative stress and the antioxidants that we normally have in our body. Under physiological conditions, this is imbalanced. It's nicely controlled. But when there's additional oxidative stress, like we just talked about, then this goes into inflammation. There's too much oxidative stress, and we create inflammation. And inflammation is another determinant of brain health. So the brain has its own little immune system. It's isolated basically from the rest of your body. The immune cells in your brain are called microglia. And when the brain is healthy, these microglia are roaming around in your brain and basically cleaning up debris, taking out some bacterial stuff, maybe some fungus, taking care of some proteins, taking care of dead neurons, and just cleaning up household duties. But when there's something that activates the immune system in your brain or causes inflammation, then these cells actually change and take on a completely different role, and they're no longer doing their housekeeping jobs. So then energy production can slow in the brain. You can have symptoms that look like brain fog, slow mental speed, slow recall, and what I call low brain endurance. And I think we all have experienced some of this when we have been sick. Our brains we're just have brain fog, we call it. And so that's, a high likelihood of this is what's happening in your brain. And then, the triggers for this inflammation, like I mentioned, could be bacteria, viruses, endogenous proteins, iron overload, even cytokines, or these inflammatory messengers that some of our senescent cells can put out. Something like a stroke or TBI, traumatic brain injury, can all set this into motion. So there can be acute inflammation, everything gets cleared up, everything goes well, and you're back to normal. But then you can have chronic inflammation and like a sustained activation of this immune system, which then can recruit immune cells from outside the brain, which shouldn't really be there. And now you're setting yourself up for this chronic inflammation that's hard to turn off. And it is this type of inflammation that's normally associated with neurodegenerative diseases. And chronic inflammation happens even with the aged brain alone. The increase in pro-inflammatory cytokines goes up. So whatever we can do, to promote better health and to provide anti-inflammatory compounds to ourselves would be beneficial. Other causes of chronic neuroinflammation could be something like autoimmunity, or spinal cord injuries, or toxic metabolites. This is a picture. I love this picture. It's those microglia, the immune system in your brain, under homeostasis or normal circumstances. They look beautiful. They do immune surveillance and they support your neurons. But when they're activated, they actually change. They produce pro and anti-inflammatory cytokines, and they increase their phagocytosis, meaning they can eat more stuff. They are better Pac-Men, and they can clean up. So this can be neuroprotective in acute instances, but neurotoxic if it's chronic. The blood-brain barrier is another determinant of brain health, and the blood-brain barrier is a semi-permeable and extremely selective barrier that separates the blood from the brain's extracellular fluid. It's very specialized. Nowhere else in your body is this structure seen. You have your capillary here, your blood vessel. It's surrounded by a podocyte and then surrounded again by something called astrocytes, which are also found in your brain. They're a type of neuron. And these allow for certain things to get into your brain and certain things to get out of your brain. And this brain or blood-brain barrier is something that, for example, medications have to overcome. They actually have to get across this blood-brain barrier. And that also goes for supplements. They also have to cross the blood-brain barrier. A good example for that is, for example, magnesium. The magnesium that crosses the blood-brain barrier is in the form of L-threonate, not the other forms. So this is a very selective membrane, but your blood-brain barrier can become leaky from inflammation, for examples, and other triggers like gut dysbiosis, viral infections throughout the body, environmental exposures, medications can cause your blood-brain barrier to become leaky, stress can do it, and autoimmune diseases can do it. And there are others, but this is definitely a good list. So when the blood-brain barrier becomes leaky, it lets things in that shouldn't be there. It also promotes the production of amyloid beta, and also impairs the transport of amyloid beta out of the brain. So a leaky blood-brain barrier plays a role in neurological and psychiatric disorders, including Alzheimer's and depression, but also schizophrenia and also Parkinson's disease. So again, some of the possible signs of a leaky blood-brain barrier are slowed thinking or lack of focus, low energy and anxiety, but also depression and headaches and neuropathy can be a sign of a leaky blood-brain barrier. Amyloid beta, we are always, this is building up in our brain, but our brain should be able to clear out most of it. And the clearance is critical to normal function. When there's a buildup of amyloid beta, it initiates the formation of something called tau tangles inside the neuron. And tau tangles, when those build up in the neuron, that neuron is destroyed and no longer functioning. When we think of Alzheimer's disease, the focus has been on amyloid beta and tau tangles for a very long time. But the question is this the cause of Alzheimer's disease, or is this something we see down the line as a result of other things? And there are a lot of medication studies on medications that target amyloid beta, and they have to date failed to work well, and they've been pulled off and studies have been stopped. So obviously there's a whole lot more to Alzheimer's disease or dementia than the buildup of amyloid beta and tau tangles. However, they are involved. This is a picture of, this is the neuron with the tau tangles inside, and this is the beta amyloid in here. So then another determinant of good brain health are our growth factors, BDNF, IGF-1, and human growth factor. BDNF is one of the most studied neurotrophins in the healthy and the diseased brain. There's a large body of evidence that says that BDNF, or brain-derived neurotrophic factor, plays a big role in maintaining healthy neurons, survival of the neurons, neuroplasticity, and even neurotransmitter regulation. So patients with psychiatric and neurodegenerative disorders often have low BDNF levels. BDNF is also crucial, in addition to something called acetylcholine, which is a neurotransmitter, not a growth factor, to long-term potentiation or the formation of long-term memory. This is a picture of how stress and infection can affect your microglia and your astrocytes, which then reduce the levels of BDNF. If BDNF is allowed to attach to the neuron, there are intracellular signaling pathways that promotes plasticity, growth, and survival of neurons. Then we have IGF-1, or insulin growth factor 1, and growth hormone. Both of these regulate development of functions of cells throughout our body. But as we get older, there is a big decrease in this and an alteration in tissue structure. And this is also the fact in the brain. Good news is we can increase these growth factors through deep and restorative sleep and intermittent fasting and exercise and supplements and diet. And we'll talk more about that later. Mitochondrial function and health is another really big determinant of brain health. Mitochondria are little organelles that are present in almost all of our cells, and they are what generate energy within that cell. Without mitochondria, you really don't generate much energy at all. And mitochondria are also involved in other tasks like signaling, and they can also signal a cell to kill itself. And it can also, if they are damaged, cause a cell to go into cell arrest or growth arrest. The mitochondria, we have, like I said, the brain is a highly metabolically active organ, and it has a lot of mitochondria in there. Mitochondria can be damaged through aging and stress and illness and other factors that increase inflammation in the brain in general. And these mitochondria can stop functioning well, but they can also exude or put out these signals that damage the rest of the brain. So the disruption in the mitochondria then can lead to these senescent cells, or these cells that just sit around and aren't functioning at all. And as I mentioned, with aging, the amount of senescent cells tends to grow. Senescent cells are cells that are in irreversible growth, and they're associated with both disease and aging. And so now there's a lot of research out there in the anti-aging industry and things like that. How can we get rid of these senescent cells when they're sitting in between normal cells? I always think of it as you get a basket of strawberries and there's one bad strawberry in that basket, and it just kind of destroys the strawberries around it. Well, that's what senescent cells do basically. They put out all these um, signaling molecules and it damages the cells around it. So how do we pick these out and get rid of them? And so there are medications and supplements that can do this. There's research on this. There are a couple of senolytic formulas that are called that have been developed in the supplement industry, and there are only a couple of companies really that sell them. Then the other part of, how do we prevent senescent cells? Really, autophagy is one of the mechanisms that we have besides keeping our brains healthy in general. Autophagy is something that happens. It's basically essential to cell survival and good function. Autophagy is the ability of the cell to take damaged things within it, to take little parts of viruses and bacteria, and to basically destroy it and reuse it or recycle it. And autophagy happens when the body is under a little bit of stress. So, for example, through intermittent fasting. A better way to look at this really is in this way. First of all, this is just a picture of a normal cell and a senescent cell. Those senescent cells, they won't die. They don't kill themselves. They just sit there and they're damaging. But this below here is a picture of one of the methods of phagocytosis. So your cells, amazing as they are, they form these little vesicles around these damaged organelles. They fuse with something called a lysosome. The lysosome breaks the things inside the cells into their components, and then the cell can use that for nutrients. And so it's a great way to have a cell survive and function better. A cell that's full of debris and non-functioning organs, they function, but they don't function well. Eventually, there's so much damage that it goes into senescence or it dies. So now that we know all these determinants of the brain health, we need mitochondrial health, low oxidation, inflammation, and so on. What can we do? What can we do now to start building that base, that healthy base, and build resilience towards what might be coming down the road? I mean, we can't live in a bubble. We're going to be exposed to things. We age, we have stress, we have illness. Those are all parts of life. So what can we do to build better base for ourselves? So there are 6 pillars of brain health, and you can look anywhere, all Mayo Clinic and all the different universities or where they have medical schools, they all have these write-ups, and they all pretty much use these 6 pillars of brain health. So what are they? They should come as no surprise, because they're generally what you need to stay healthy, throughout your body. But pillar 1 is exercise. There is nothing you can do that is better for you than exercise. Hands down, for your brain, for general health, for whatever it is. You don't have to be an athlete. You just have to move. When you look at all the blue zones in the world, the one thing that you see is that people are active. They're not necessarily out exercising, but they are active in their gardens. They walk and but we have exercise that we can utilize and leverage. A healthy diet is, of course, very important to brain health. Social engagement is another pillar. Good cognitive reserve and neuronal connections is another pillar. High quality sleep and recovery is one. And then, of course, you have to have good health, and seeing your doctor regularly, assessing your health status, that is another pillar. So on top of these pillars, we can build a really resilient brain. And then, of course, I think there's a 7th pillar, and that's mental health, but again, requires really a lecture all on its own. So why is exercise good for your brain? Well, it increases the size of your hippocampus and other parts of the brain that are involved in memory and learning. It stimulates the release of growth factors, BDNF, IGF-1, human growth hormone that we talked about earlier. It increases circulation and can promote the formation of new blood vessels in the brain. It increases the abundance and the survival of brain cells. So it's involved in neurogenesis. It increases serotonin levels, reduces depression, reduces inflammation, and it increases the number of mitochondria, which we've just talked about, are so critical to the brain, to brain function. And then, on top of all that, there's a direct connection between physical toughness and mental toughness. Life can be hard sometimes, and we need to be mentally tough. And exercise can be one of the ways that you can use to improve your mental toughness. How long and what kind of exercise should you be participating in? And basically, aerobic exercise 5 times a week, 30 minutes at a time is recommended, but even twice weekly has been shown to be beneficial to brain function. Then we have resistance training, which improves several aspects of cognition, and there's a direct correlation between grip strength and cognition and dementia, and also lifespan. There's marked improvement in memory and memory-related tasks when you do resistance training. A couple of times, 2 to 3 times a week is enough. There are also other types of exercises that confer additional benefits, high intensity training and things like that, but I'm not going to talk so much about that. These are just general recommendations for aerobic and resistance training. This is really a composite of 20 students. On your left, there is a picture of the students taking the test after they've been sitting quietly. On the right, same students taking the same test after they've been out for a 20-minute walk. So as you can see, the function of the brain is a lot better after you've been active. This is another picture of how physical activity affects your brain health. It increases BDNF and blood flow. It's antioxidant. It increases plasticity of the brain, increases white matter integrity, brain volume, and functional connections. Then, of course, there's the diet, the second pillar that we mentioned, and maintaining a healthy diet. So food and nutrition are essential, basically, for brain health. Drivers of cognitive decline, including all the parameters that we've talked about: oxidation, inflammation, leaky BBB, mitochondrial dysfunction. All these are influenced by your diet. You can leverage your diet to improve and optimize brain health. And I'm not just talking about prevention of, Alzheimer's disease and dementia, but also day-to-day functioning of your brain. One of the diets that has been proposed as a really good diet for prevention of Alzheimer's disease, but also in general, brain health, is the KetoFlex 12-3 diet. This diet has been promoted by Dr. Bredesen, who is the author of a book called Ending Alzheimer's Disease. And the diet has also been adopted by the Amos Institute of Brain Function, of Optimal Brain Function. Dr. Amos is a neuroscientist and a psychiatrist that has been involved in lots of research, has written plenty of books. I'm going to go grab my I have to go grab my charger. Just a minute. It would be highly embarrassing to lose you all. Okay, all right. So micronutrients that are good for the brain: flavonoids, they're anti-inflammatory and antioxidant, support blood vessel function, increases BDNF. Essential fatty acids are really important because they are integral to the neuronal cell membranes and also the mitochondrial cell membranes. They're involved in synthesis of brain neurotransmitters as well. And studies show that people with a low omega-3 index have an increased risk of dementia. B vitamins are also really important to brain function. Folic acid, vitamins B6 and 12 reduce levels of homocysteine. Homocysteine is a toxic amino acid that's linked to an increase in Alzheimer's disease and stroke. It's an inflammatory marker that can be tested in your blood. Adequate intake of folate and B12 are also important for the myelin sheath. And B1 is really important for maintaining what's called a nerve's membrane potential and proper conduction through your nerves in the brain. B1 can be depleted by heavy alcohol intake, for example. And there is actually a disease called Korsakoff dementia or madness that is linked or is caused by a B1 deficiency and has been seen in people who are heavy alcoholics long term. Deficiencies in selected B vitamins have also been linked to things like depression and anxiety. This is just a slide that you can look at on your own. It just basically tells you a little bit about common dietary flavonoids and where you can find them. And then, of course, other important nutrients include minerals, antioxidants such as CoQ10 and L-carnitine. L-carnitine is interesting because it's like a little bus that shuttles fatty acids into your mitochondria so that your mitochondria can use it for energy production. CoQ10 is a great antioxidant. We make it in our bodies in the same pathway, actually, that makes cholesterol. It's an important part for ATP or energy production, and it's an important antioxidant. And we have all our vitamins that are both fat soluble, and we have water soluble vitamins, and they are work on different parts of your cell and your body. Amino acids like tryptophan, tyrosine, and phenylalanine are important in the brain because they can cause changes in things like sleep and appetite and pituitary hormone secretion, even blood pressure. And then, of course, your brain uses glucose for its preferred food. You can also use ketones. And everybody's heard about the ketone diet. And ketones are really actually very good for your brain. And when we go back to, let's see here, KetoFlex diet, that they talk about intermittent fasting, which promotes ketosis. And they talk about fasting or eating within a 12-hour window or less during the day, and to stop eating 3 hours before bed, because those 3 hours plus your bedtime of fasting, during that time, you'll form ketones. And ketones are nice and anti-inflammatory for your brain, and your brain can actually use ketones for energy along with glucose. It cannot really use anything else. Okay, let's move on here. Let's see, where was I? Okay, yeah, this. I love this picture because it shows that there are receptors for vitamins on your neurons. And then you can look at this yourself if you want to. But there are signaling cascades that then go on to promote the health of the neuron. This is a case study that I pulled from SpectraCell Laboratories. And this was the case of a 44-year-old female who was complaining of memory deficits. She didn't have any chronic illnesses, really. She had a lot of pain, and she was treated for that. But she had no increase in headaches. She didn't really have any neurological symptoms. But she had memory deficits, and at some point even had difficulty in, like, she forgot how to spell things or how to write certain words. So her physician ordered a nutrition panel for her and found several nutritional deficiencies, corrected for these nutritional deficiencies, and within 6 months, she no longer had these deficits. Now, in her case, we can look at her medication list and go, because a lot of medications rob you of certain nutrients. So, nutrients being as important as they are to your brain, we really want to know where we stand here. You should be okay with a healthy diet. But for people who have, unexplained memory deficits, who are on multiple medications, or who might have GI distress like IBS or IBD, or are on proton pump inhibitors and aren't absorbing necessarily the nutrients from their foods, it's a good idea to check your nutrition status. And I have a list of blood tests later on that we can talk about more about this. Shout out to the gut, of course, because your gut produces more than 30 hormones and signaling molecules that influence a lot of functions, including brain function. Some of these molecules get into your circulation and they go up to the brain and actually cross over the blood-brain barrier. And others act more locally. So the kind of the end terminals of your vagus nerve in your gut, they can affect directly the vagus nerve, and then that vagus nerve can transmit messages directly up to your brain from that. So in addition to making all these hormones and signaling molecules that can serve us, you know, you can also have gut dysbiosis. And with that, there is an increase in these lipopolysaccharides, which are basically just like partial membranes of bacteria and such. And with gut dysbiosis, you also have an increase in inflammation overall in your body, and that can cause blood-brain barrier permeability. So it's important to pay attention to your gut health and a healthy diet, lots of fiber, low stress, exercise, many ways to do this. This is just a picture of your brain, how it influences our digestion, and then again, how our digestion can in turn influence the brain. I love this cartoon because I think most of us know what we're supposed to do, but then our heart or habits or whatever you want to call it fight that little. You have to fight with that, you know. But we have a prefrontal cortex. We have cognition, and we can use that to change our habits and to change our neuronal patterns, and you know, get to the point where these habits that are good for us become just another thing that we do. We don't even have to think about it. Another one of the pillars of brain health is staying socially connected. Socializing actually stimulates attention and memory, and then strengthens your neuronal networks. You know, you're just out there laughing and having a good time and being with friends, but your brain is hard at work while you're doing this. You know, being socially active can be stressful for some people. So, but you know, withdrawing from social life is really a risk factor for dementia and really all-cause mortality. Lots of studies on the fact that social isolation leads to earlier death and earlier onset of cognitive decline. Then another thing that we can, you know, build as a pillar for, you know, preserving our brain is to build reserves and cognitive reserves. Brain reserves really refers to the structural part of our brain, the number of neurons we have and the myelin sheath that we have and the blood flow that we have. Whereas cognitive reserves, it really refers to how efficiently we make use of that brain reserve. So the cognitive reserves can be things like our education, literacy, occupational attainments, leisure activities, hobbies, things like that. And those individuals with higher cognitive reserves are thought to be able to accomplish more for any given level of brain reserve. So it's like money in the bank. So think of it this way. If you have one road to go somewhere, that road gets damaged, you can't get anywhere. If you have several roads to get somewhere, one gets damaged, you still have all the rest of these roads to get you to where you need to go. It's the same thing in the brain. You build up cognitive reserve and brain reserve so that if something happens, you've got plenty other options. In order to build cognitive and brain reserves, you really need new and novel activities. So if you're an analytical person, try something like arts or dancing, or you know, something that requires a different way of using your brain. If you are a very artistic person and you don't like a lot of analytical things, you know, sit down and try to do some of those tasks. Learn a new language, play games. You just have to get out of your comfort zone in order to build cognitive reserves. And doing this even promotes the health of the oligodendrocytes that build the myelin sheets that we talked about earlier. So lots of benefits there. This is a picture of a person with low reserves and a person with high reserves. And it takes longer, first of all, to start the decline. And when you do start the decline, the onset of AD neuropathology comes on a lot later, or incidence of dementia comes on a lot later. Then another pillar is sleep, of course. Everybody knows that sleep is important to overall health and mental function, but there are processes that happen at night that don't happen when in the daylight hours or when we are awake, that have profound effects on our brain health and cognitive fitness. It's the time when we clear out our amyloid plaques, for example. I found this very interesting. There's a system in our brain called the glymphatic system. And this system really wasn't discovered until 2010, 2012. So it's a relatively new discovery, but it's a system outside of our circulatory system that promotes clearance of amyloid beta, metabolites, and even brings in nutrients to the brain. What I find, interesting about sleep and cognitive function is that this system it's basically disengaged when we're awake and only active when we're sleeping. This is a picture of that system that you can take a look at if you want to. Speaking about sleep and how important it is, when people come in complaining of insomnia, we have to look at all the factors that play in. And we always talk about sleep hygiene as the first thing. So are you avoiding alcohol 4 to 6 hours before bed? Are you avoiding electronics at least an hour? Do you have a cold and dark bedroom? Our body temperature is supposed to drop 1 to 3 degrees when we're sleeping. If we are fighting against that natural process by wrapping ourselves up in super warm covers and a cozy bed and pajamas and nightcap, all the stuff, then your body's constantly trying to cool you down. So you sweat and you wake up. Of course, there are times in our lives during menopause and things that you can't really control that very much, but most of the time you can help out. Keep it dark and cool in your bedroom. Establish a bedtime routine and something like reading a book or taking a bath. And then look at your sleeping situation. Are there 2-legged or 4-legged animals in your bed? And I find it interesting. A lot of people that come in with insomnia, when we start talking about it, they have a dog or a cat or something like that disrupts their sleep all night long. And if this goes on for long enough, it will have a negative effect on your cognition and even on your ability to just function the next day cognitively. So, think about it. Get rid of those little obstacles to good sleep, or at least do your best. I know it's nice to have your pet in your bed, but when you get about an inch to sleep on and they move around all the time, then maybe it's time to think about putting their bed next to your bed and not in your bed. Then, if you've done all the things, sleep hygiene is good, you do all that, and you still have sleep problems, then you need to assess your overall health status. Consider medications. Are you taking some medications that might be affecting your sleep? If you have anxiety or depression, or you're extremely stressed, seek mental health counseling. Try hypnosis. Assess your stress levels at work, see what you can move around so that your life is more manageable. And then consider your circadian rhythm, getting up at the same time, going to bed at the same time, getting into daylight as soon as you can when you wake up, have a dark, room so you can promote melatonin production. Sometimes or oftentimes I'll have to send people in for a sleep study. And I love this. I always think about this like, going in for an in-house sleep study. They hook you up to all these wires and then they just tell you to sleep normally. And I never understood how you could get a good study from that, but that's how it's done. Other ways to rest would be through mindfulness and meditation and spiritual practices. And research shows that people who meditate about 30 minutes a day for 8 weeks have an increase in the brain matter that is associated with memories, sense of self and empathy, but also a reduction in the gray matter that is associated with anxiety and stress. And meditation doesn't, there are many ways to meditate, and it doesn't have to be so hard. And you can work your way up to 30 minutes. Sometimes running or walking in nature can be meditative. It's not like you have to sit with your legs crossed and, chant Om. That is not necessarily the only way to meditate. There are many ways to do it. Um, you know, Mindfulness is a state of active, open attention to the present. So when people come in and they have memory issues, I always think about focus. And in our days, we are so busy. And we have our brain is full of the things we should do, have not done, need to do. And we're not really staying focused on the task at hand. And that does not allow for good memories to form. And I always think about this when I'm with my grandson, and I want to make the most of it. And I clear my mind. I really do. When all these things come in from the outside, and I should be doing this, I need to be doing that. It's useless. I'm not going to be doing it. I'm going to be with my grandson. I want to enjoy it. So training yourself to really observe what your thoughts are doing and stopping all that, just, observing it is enough to help you stop letting all these extra thoughts come in. And it's the same at night. At night, you're in bed, you're going to be sleeping. There's nothing you can do about the things that, you have no control over while you're in bed. So training your brain to kind of get rid of this mindful noise that we have is a good way to keep good cognitive function and to have daily good cognitive function. I want to talk about hormesis just briefly because we talked about autophagy and how a little stress can be good for autophagy. And hormesis really is a small physical stressor that upregulates your body's natural defenses and abilities to do things well. Small stressors, the easiest ones to implement would be things like intermittent fasting, super cold showers, high intensity interval training, not for everybody, but those are the stressors that can be good stressors and that can increase autophagy and help us clear out those damaged things within the cell. So a little bit of stress is okay, a lot of stress, not okay. I want you to consult your physician if you're considering sauna or epoxy training or interval training or anything like that. It's not suitable for everyone. Okay, so we've talked about the determinants of brain health. We've talked about the 6 pillars upon which we can rest, and have a good baseline for whatever might come our way. Now I'm going to switch gears a little bit and talk about the various tests. So that is another pillar, like see your physician regularly and know your health status. So the blood test that I recommend would be an advanced cholesterol panel. Regularly, PCPs test your cholesterol, but not to the degree that I like to test them and that they should be tested. We need to know what your LDL looks like. Is it dense? Is it small? Is it oxidized? We need to know what your ApoB levels are and your LPA levels. All those things are risk factors that are associated with cardiovascular disease and dementia alike, and other diseases as well. You want to check your inflammation markers. We talked about homocysteine. HSCRP is another inflammation marker. If you have a family history of dementia or Alzheimer's disease, you can get the ApoE genotype tested. You can test yourself as a genetic test. And ApoE, there are 4 variants that we know of, 1, 2, 3, and 4. And ApoE4 is the one that's associated with dementia. You should be checking your blood sugar levels through hemoglobin A1C, check your liver and your kidney function, check your CBC. You shouldn't have anemia or too many red blood cells or too few platelets or too many platelets. Ferritin is another good thing to check because iron overload is detrimental to the brain, but too little iron, you don't get a good amount of oxygen transfer to the brain. You can test your insulin growth factors. It's not done very often. Get your nutrition tested. Generally, the primary care providers and your insurance company will only cover a few of those. But you can order tests and pay for them out of pocket. You don't have to do this annually, but if you have certain illnesses, or even if you're just generally interested in your nutrition levels, I use NutraEval. It's an excellent test. It uses blood and urine to evaluate for your nutrition. Very, very broad evaluation. Make sure you check your thyroid hormones and your sex hormones. But all of these hormones are really important also to brain health. There is a test you can get for cytokines, which are these inflammatory signaling molecules. They're not done very often, but in some cases they can be done. And then food sensitivity and food allergy tests can be done because we've talked about how important gut health is to brain health, to reduce overall inflammation, to keep a good blood-brain barrier. This is a slide on ApoE that you can look at and why ApoE is important, why ApoE4 is tied to Alzheimer's disease. You can look at this on your own and if you're interested. There are also stool tests that you can do for gut health. Your microbiome can be assessed. You can get a comprehensive functional test, and you can get a test for inflammation called calprotectin, and you can even check for leaky gut permeability or leaky gut through zonulin. Urine tests that are available. You can test your heavy metal burdens through urine. And you can test mycotoxins through urine. Every day we ingest mycotoxins. They're found in all the grains, anything that's stored. Think about all the transport of grains on big ships and whatever. There's going to be fungi. There's going to be mycotoxins in what we eat. So I always, think that a variety of foods is good, because if you eat one thing all the time, you're getting the same mycotoxin over and over and over and over again, and these can build up and cause problems, neurological problems, and a myriad of symptoms that really are, can be hard to kind of figure out. Organic acid testing is another way to test for metabolites and for nutritional deficiencies. You can also check your hormones through urine, and you can also check your cortisol levels through urine. Interestingly enough, high cortisol levels causes a reduction in BDNF. And then we have salivary testing. You can test your cortisol also in saliva. And then, of course, you have a lot of genetic tests that uses a cheek swab. And there are multiple genetic tests that you can do. And there are many reasons for running genetic tests. So it's something that you'll want to discuss in detail with your practitioner if you're interested in that. Other assessments, there are functional MRIs. There are MRIs with volumetrics. There's actually a place in Portland that does this. Insurance doesn't like to cover it, even though both MRI with volumetrics and amyloid PET scans have been approved by the FDA for evaluation of dementias. They're not covered by your insurance companies, but they are available. Then there are cognitive assessments that can be done, and this usually happens once you hit 65. They'll be hitting you with these cognitive tests when you go in at least once a year to your primary care provider. There are many of these cognitive assessments. And if you need broader cognitive assessments, say there is a suspicion that you have early signs of dementia, there are additional tests that you can do. Then there's a coronary calcium score. If you have plaque buildup in your coronary arteries or even in your carotid arteries, chances are you have some calcium buildup in your brain as well. The hearing and vision testing is important because actually loss of hearing has been tied to earlier cognitive decline. Do a sleep study if you're not sleeping well, know your BMI, and get your blood pressure checked regularly. So that was blood tests, urine tests, stool tests, all with the thought in mind that either you figure out what's going on and why you're having memory deficits, or you monitor for prevention, which is far more important By the time someone has signs and symptoms of dementia, the process has been ongoing for 15 years, 10 years at least. So this is something you want to do on, continually. The 6 pillars of health, which includes, regular testing of your parameters. And, talk to your doctor about this, push the button a little bit. You are the one that decides what happens to your health. And so, with a little bit of push, some doctors are willing to maybe do some additional testing for you. Otherwise, see an ND, see a functional practitioner, and get these blood tests done. So switching over to brain boosting supplements. So CoQ10, you can supplement with CoQ10. As we age, these things we make less of it. If you are on a statin, you make less of it. So CoQ10 improves mitochondrial function and is a powerful antioxidant. 200 to 400 milligrams per day is perfectly safe. You can even 50 milligrams a day for some people. Acetyl L-carnitine is another neuroprotective supplement. This you get from meat actually, and we make it, but again, lower levels as we age. It's neuroprotective. It's also heart protective. It helps maintain good mitochondrial function. Then we have alpha lipoic acid, which is a powerful antioxidant and is active, fat soluble, so it actually works with your neurons. Then you have CDP choline, which is a phospholipid that's essential to brain health. I think this is one of the more important things to supplement with, especially if you've had a concussion or something like that, or a stroke, or other neurological conditions. CDP choline also just for general brain health. Then you have your omega-3 fatty acids. I always recommend omega-3 fatty acids. There are actually receptors on neurons for DHA. That's how important it is to your brain. And so, let's see, the other part of the omega, the EPA, diffuses without receptors into the brain, but DHA actually has receptors. It prevents oxidative stress, anti-inflammatory, and it forms something called protectins that help protect your neurons. And then you have taurine. Taurine is kind of like it is an amino acid. We make taurine. We can eat it, get it through food, and you can supplement with it. It's important for mood even, and for appetite regulation. So it's has really important functions in your brain. It's also antioxidant, improves energy, improves neurogenesis. Then we have magnesium L-threonate, which I mentioned earlier, is the type of magnesium that crosses the blood-brain barrier. Magnesium is involved in up to like 300 enzymatic reactions, and it is necessary for the proper functioning of your brain and nervous system. And there are studies out there that show that people, I think this was a study, people were 70 years or 75, I can't remember exactly, that took magnesium L-threonate for a certain amount of time, and they had improved cognition across the board. I take magnesium L-threonate. It helps with my sleep too. Then there's creatine. Creatine, most of the time we think about creatine, we think about muscle, bodybuilders and things like that, but creatine is essential in your brain. It's essential if you had a concussion or a mild traumatic brain injury or something like that. It eases the symptoms of depression. And a lot of people now are saying that taking, 5 grams of creatine daily improves cognition and mood and is helpful regardless of age. Then you have B vitamins, like we talked about earlier, and the importance of them for methylation, for neurochemicals, for signaling. And then we have NAD+, which is kind of newer on the market, NADH, NAD+. And NADH is just another energy molecule, basically. And it's big in the anti-aging industry. I use NAD+ before I work out, and it helps me with my energy in my workouts. I love astaxanthin. Astaxanthin is capable of crossing the blood-brain barrier, which we talked about. It's really important to know which antioxidants cross and which do not. Astaxanthin does. It's what makes the red color in salmon, for example, and in all crustaceans. That's astaxanthin that does that. It's one of the strongest antioxidants in nature. You only need 6 to 12 milligrams per day. This has been around for a while, but it's kind of become more popular lately again in the supplement industry. Then we have bile acids, or TUDCA. And most of the time we think about bile acids as, helping us digest fats, but bile acids are also have important functions throughout the body, and actually has been studied for Alzheimer's disease. And there are some favorable outcomes of those studies. So it's anti-inflammatory, anti-apoptotic, antioxidant. And then we have apigenin. Apigenin is not a common one that you see out there, but it's found in chamomile, artichoke, passion flower. It's pro-cognitive, neuroprotective. It can help people who are on opioids it helps prevent the need for more and more. So it prevents that kind of building up of tolerance. It's also helpful for misfolding of proteins. Then you have NeuroSilk. Only a couple of companies that sell this, very new on the market. It basically is beta amyloid blocking. It increases BDNF and it decreases intracellular calcium. I don't want to go into kind of the details and the biochemistry of all of this. We don't have time, but intracellular calcium levels are important. And then we have green tea derivatives, for example. And there are multiple more, but this is a really good list of tried, true, and proven through studies to be effective supplements. Then you have herbs like ginkgo, and always use that when there's a need for extra blood flow. Vascular dementias in particular can be helped by this. Then there's lion's mane. A picture of that is down here. It's a really funky looking little mushroom. It has special compounds that stimulate the growth of neurons. Then you have huperzine A, which is Chinese club moss, and I believe this second picture here is a picture of that. And that basically increases acetylcholine, which is a neurotransmitter that is necessary for forming memories. Then you have Bacopa monnieri. Long-term use of this has been tied to improved cognitive performance. It also increases GABA and modulates serotonin and helps neurotransmission. Rosemary, amazing herb. It's hard to find this kind of a source that crosses the blood-brain barrier, but when it does, it's excellent. It's antioxidant. It's also anti-tumorigenic generally. Anti-nociceptive, so it decreases pain, and it can help with anxiety and sleep. Then you have astragalus. Astragalus is what we call an adaptogenic herb, but preclinical studies suggest that it may preserve learning and memory. And I've actually found additional studies on an extract of astragalus called astragaloside 4, and in that it actually can reduce the buildup of plaque in arteries. So it's hard to find. I think there's only one supplement company that makes it, astragaloside 4, that is. But you can take astragalus, and astragalus is really good for, stress and for adaptation to stress. So overall, just a great herb. So nobody wants to take million supplements. So of course, use the pillars as your main focus and then supplement as needed. And that can change with illness. It can change with age. It can change with, whether you have nutritional deficits or don't eat certain things and what your diet looks like. If you're on a ketogenic diet, you need certain supplements. If you are on a vegan diet, you need certain supplements. So, kind of your doctor can help you kind of maneuver that, and so that you're taking what you need and getting what you need. There are combinations of things that are found in various, brands. Ultra Brain by Energy Blueprint Labs, the neurological formula that is by Intelligent Nutraceuticals. my company. Then we have senolytic formulas through life extension. And then you have formulas for focus support through Nordic Naturals. And there are a myriad of these on the market. So not you don't have to take everything for your brain separately. You can combine it into one supplement. Always think about your medications when it comes to brain health. There are certain medications that have been tied to dementia. One of them is anticholinergics. This is a broad kind of a category of medications, but they can be used to treat incontinence and depression, muscle spasms, even allergies. You can buy some of these over the counter, so watch what you're taking. Hypnotics have certainly been tied to dementia. Those would be benzodiazepines like Xanax or Ambien for sleep or orexin drugs for sleep. Proton pump inhibitors have also been shown to cause proteins like beta amyloid plaques to build up. In addition to that, proton pump inhibitors prevent absorption of certain nutrients. So if you're on a proton pump inhibitor and you have no choice but to be on one, then make sure that you are supplementing with things, whether it's B12 injections or taking extra oral B12, and talk to your doctor about that. Pain medications, they have been associated with whether it's a cause or a result of we just don't know, because people with pain have increased risk of dementia, and people with pain use pain medications. So it's a little hard to tease that out. Then you have antipsychotic medications, of course, that alter really the structure of the brain and are definitely tied to cognitive decline. So, building resilience through, the 6 pillars, supplementation if you need to, and, kind of concentrating and looking at all those determinants of brain health that we looked at is a great thing. Resilience also means, going with the flow as things change, as things happen in your life, not letting that one thing kind of put you back and make you depressed and not want to do all the other things that you can do. We need to be flexible. One of my patients has a friend who said aging was like playing a game of whack-a-mole. You whack something comes up and you whack it, then something else comes up and you whack it. So you basically just have to learn how to be a little bit resilient. You are stronger than you think. There are a lot of myths about aging that we kind of get wrapped up in. Oh, I'm getting older, so I won't think as well. That does not have to be the case. You can still move, find a way to do it. You can still socialize, find a way to do it. You're stronger and more resilient than you think. There are some great books out there and some wonderful podcasts that I have listened to and read, and there's a list of them here. So please, seek them out. I always feel like if you need to make changes, you need motivation to make those changes. Understanding, in my mind, is motivation. Listening to people who are, really up to date on these things and who interview people who are inspiring. All those things help us make changes less difficult. And sometimes we just need to make some changes. And so, to make use of all these tools around it and seek out the people, the physicians, the friends, the books, the podcasts that will help you get to the point where you need to be. I appreciate your attention today. I know we've gone a little bit over, not a little bit, quite a lot over, 14 minutes over, but it's been a lot of fun to go through this with you. It's a lot of information, but I hope that you can take some nuggets from this, apply them to your life, and improve your cognitive health. So with that, I am done. And if there are any questions, please let me know. But with all the things that we've been through, it's a little bit hard to keep up, but you will have a recording, and I hope that you can go back and look at this and then, do some research on your own to find additional, answers and suggestions.
Thank you so much for all this information. Tons of great information. Um, this recording will be posted on Fort Vancouver Regional Library's website. Give us a few days. Like I said, we're going to do some closed captioning, but we'll get it out there and you'll have access to all that information. So again, thank you everyone for joining us. Thank you, Dr. Cox. It was a pleasure. Have a good night, everyone.